play around with the wiring. So,
That's like fish.
what's that?
It's like it's in the
Well,
fish.
yeah,
It's in the fish bowl.
It's the right theme, the water theme.
So thank you for coming out tonight. We have an elite crowd and a really great opportunity to hear a very, very wonderful, kind, compassionate pediatric dentist, Denise Cohen, who we work very closely with, speak to us about the importance of dental care in babies and young children, and other important issues around dentistry in our children.
Thank you. So thank you for coming tonight. I know that this is the week between camp and school, and it's 7:30 at night, and so I appreciate you being here. So I call this the Pediatric Dental Pearls, and this is an assortment of what I found to be the most commonly asked questions that I get from parents when they come to my practice, and I put it all together, and I hope you enjoy. So just a little bit about me. I'm a local girl. I was raised in North Woodmere, went to Binghamton, from there to New Jersey Dental School. I did 2 years of pediatric specialty over at Long Island Jewish Children's Hospital. I'm board certified, and I'm also an attending pediatric dentist at North Shore, LIJ in Winthrop, and my practice is in Hewlett. So a lot of times parents ask, when will my child's teeth come in and when will those teeth fall out? And so these two charts sort of give an overview as to the time frames you can expect for the eruption and exfoliation of the teeth. The average age for the baby teeth to first come in is about 6 months old, and typically the lower two front teeth come in first. The rules and numbers are only average. I've seen children whose top teeth came in first. I've seen children whose lateral incisors, which are not the center ones, but the ones off center, came in first. And I've seen children who had their first tooth come in at 3 months and at 14 months. So the numbers are purely average. But this is what you can expect as far as when the teeth come in. And then the first baby tooth, again, the bottom center incisors normally fall out at about 6 years old, and then also at 6 the permanent first molars come in, and those grow in behind the baby molars. So unlike the front teeth, the permanent molars do not push any baby teeth out when they come in. So a lot of times parents are surprised when they come in and I say, oh, your child has 4 big boy or big girl molars, and they're surprised because nothing fell out for those to come in, and those sort of come in behind everything else. So what to do if your child has teething pain, sleepless nights, crying, hugging, but basically cold things are soothing. So you can use a cold teething ring, you can use a cold compress, you can massage the baby's gums with a clean finger, you can use a small dab of a teething gel such as Oragel on any areas that seem red and raw, and if they're still not having any relief, you can use a little infant's Tylenol or Advil. So what should I do when my child's tooth falls out? Some parents are very nervous. If the tooth is loose, they don't know, should I wiggle it, should I not wiggle it, what should I do? And a lot of times the kids are nervous as well, they don't want to wiggle it, and then the tooth just starts migrating across the mouth from being so loose. So yes, you can absolutely help your child wiggle the tooth with 2 fingers and just a back and forth motion, and that should help the tooth fairy come quicker. So how should I care for my child's teeth? So before the teeth even come in is when oral hygiene should start. You want to clean the baby's gums even when there are no teeth, just by using a damp cloth or a damp gauze, and just wipe the baby's mouth after each feeding, and especially after the last feeding at night. Excuse me. Once the first tooth comes in, that's when you should start brushing, and the latest guidelines are moving away from training toothpaste, and they're advocating using fluoride toothpaste from the beginning. A tiny smear, and this image sort of just shows you the size of a grain of rice until the child is 3, and then between 3 and 6 you can graduate to a pea-sized amount of fluoride toothpaste. The reason we recommend these amounts is they are swallowing the toothpaste at this age, and this is to make sure that they're not swallowing too much, but they're still getting enough to receive the benefits. You also want to floss as soon as any two teeth touch. Some kids have the two front teeth on the top or the bottom touching from the beginning, and so you want to floss those right away. Other kids have spacing, so really whenever you see two teeth touching is when you should start flossing. So in addition to brushing and flossing, how can I prevent cavities in my child? And I put the word diet in huge letters because diet is such an important piece of the puzzle when it comes to cavities. So I'm sure these look familiar, and whenever I talk about these items, the parents always get a huge smile on their face, and the kids sort of get this nervous giggle in the chair, and the words that follow are always like, but those are my favorites, those are my favorites. And so the hope is to not introduce these items as possible for as long as you can, and I know that the kids get to a certain age where it's unavoidable, and they get them from school or from a friend's house, but for as long as you can keep the candy, the juice, the soda, the sports drinks away, the better, because then your children will learn to appreciate water and learn to appreciate healthy foods instead of becoming used to having sweets early on. So as I said, you want to limit the sweet drinks. A big question that I get a lot is, what about organic juice? People hear the word organic, they tend to think that it's healthier, but when it comes to sugars in the mouth and the development of cavities, the mouth doesn't know the difference if the juice was organic or not organic. Sugar is sugar, and all sugars can lead to cavities. So you want to limit any sweet drink to only 1 cup a day. And there's really no, it's not even a must for the child to have 1 cup a day at all. So if children just want to drink water and milk, that's perfectly fine. There's no reason to push apple juice or juices unless your pediatrician tells you that they need it for constipation or not. Dr. Green's even shaking his head no. So,
we usually limit prune juice to infants, and past the infancy age, we'll use other agents and avoid juice.
Perfect, perfect. You want to limit the sticky and the sucking sweets as much as possible. Lollipops, taffy, gummy bears, fruit snacks. People are always surprised when I say that fruit snacks are actually just a candy because the manufacturers put in huge letters, all natural, 100% vitamin C, and it's very deceiving. It's very clever marketing that deceives some parents into thinking that fruit snacks are actually healthy, but they're really just candy. So those, and again, even organic, people say, what about organic fruit roll-ups, organic lollipops, same thing, candy is candy, so you want to limit those sticky and sucky sweets wherever possible. People always look at me and say, you know, gosh, Dr. Denise, I want to treat my child to something yummy once in a while, what can I give? So things that don't stick to the teeth are preferred to the sticky and sucky candies. So plain chocolate is a nice alternative, plain ice creams, because those things melt, they don't cling to the teeth the way a fruit roll-up or a lollipop would. And then lastly, milk does have some natural sugar, so if the child is not having milk with a meal, I say milk with a chaser of water, just a little water afterwards to at least cleanse the mouth if you're not able to brush afterwards. So one of the newest things on the market now is xylitol, and xylitol is the naturally derived sugar alcohol, and it's actually been clinically proven to help prevent cavities. The way xylitol works is that xylitol, as I said, it's a natural sweetener, but it does not allow the bacteria in the mouth that typically produce cavities to digest xylitol, and therefore the bacteria cannot produce the acid, and therefore you can't get a cavity. So, and I'm not paid by this company at all, but there's a company called Dr. John's that makes these fun tooth-shaped and other shaped xylitol lollipops. They are available in kosher. And the only thing I tell parents if you're going to purchase these lollipops, which are great, is that make sure your children know that they can only have the lollipops that you're giving them, that they're the xylitol pops, and so that they won't think that they can have any lollipop, that these are the special lollipops. And then one other thing is that you should not put your baby to bed with a bottle of milk or juice, and you should brush after the last feeding of the night. Some babies are put to bed with a bottle of milk or a bottle of apple juice, and what happens at that point is that the sugars sit on the child's teeth overnight. The bacteria accumulates and the children end up with many, many cavities. So it should be last feeding for the night, and this includes breastfeeding because there is natural sugar in breast milk. So last feeding of the night, brush the child's teeth if they have teeth, and if there are no teeth yet, wipe with a wet gauze, and then put the child to bed without a bottle. Some kids still wake up at night, they're crying, especially if they're teething and they're uncomfortable. So if you want to give them a drink at night, only water, no milk, no juice or formula in the bed. So this picture, I don't mean to spoil anyone's appetite for dinner, but I get asked all the time, why do I need to fix the cavities in baby teeth? Don't baby teeth fall out anyway? I hear that question more often than you'd think. I hear that question a lot, even from when a parent brings a child in for a visit, the child has cavities, and then they go home and they tell grandma and grandpa about it. Grandma and grandpa sometimes tell this to the parent, and the reason why you have to fix cavities in baby teeth is, yes, they do fall out, but not for quite some time. So the front baby teeth don't fall out until average of 6 to 7 years old, and the back baby teeth don't fall out until about 10 or 11 years old. So if you think about it, a 3, 4, 5-year-old with a cavity, if it's untreated, it will grow and grow and grow and become infected, and then you can end up with a facial cellulitis or a facial infection, which is actually can be a life-threatening situation. This child, it all started with an upper molar that had a cavity, did not get treated, grew, became infected, and then the child woke up one day with a swollen face, had to get admitted to the hospital for several days of intravenous antibiotics, all from something that could have been avoided, number one, and B, could have been fixed with a simple filling. So if someone ever asks you, why do you need to fix a cavity on a baby tooth? This is why. So when should I start bringing my child to a pediatric dentist, and every how often? So the slogan is first birthday or first tooth should be the first dental visit. And at that visit, I would assess your child, your habits, and then make sure that they will not be the child with some of the mouths that I showed you previously. So oral habits, pacifiers, thumb sucking, finger sucking, and also sippy cups. So these 3 mouths are typical for children who either suck a thumb, use a passy, or use a sippy cup with a hard top past the age of about 2. So what picture A shows you is if the child turns to the side and smiles, the front teeth are way further out than they should be, and that's called an excess overjet, meaning the teeth jet out much farther than they should. Slide B shows you what's called an open bite in the front, meaning even if you tell the child, close your mouth and smile, their front teeth will not come together because there's that physical barrier of a passy, a sippy cup, or a thumb there preventing the teeth from actually coming together. And then picture C shows you what's called a posterior crossbite, and basically what that means is that the child's back teeth look like they're shifting to the side, like as if they're pushing the jaw to the side, but they're not really. And what's happening is that the sucking motion is actually restricting the growth of the upper jaw. So rather than having a harmonious relationship between the 2 jaws, where the upper jaw is slightly bigger, because they're sucking, they're restricting the growth of the top jaw and causing that crossbite. So you really want to try, as far as the sippy cups go, you should use one with a straw, is much preferred to the ones with the hard top, because the straws will not cause a problem the way the hard top sippy cups do. And then as far as the thumbs, fingers, and pacifiers, you really want to try to work on discontinuing those by the time the child is 2, because children who persist past the age of 2, number one, it becomes psychologically more difficult to break the habit because they've been doing it for so long. And number 2, research has shown that children who suck past the age of 24 months are more inclined to have these malocclusions or unharmonious relationships between their teeth. So lastly, just a few highlights of dental and intraoral trauma. This child tore their upper maxillary frenum, and no, that is not my finger without a glove in the child's mouth. I found the slide. So the frenum is a piece of tissue that attaches your upper lip to your gums, and oftentimes, especially when kids are young and they're learning to walk and they're running all over the place, sometimes they fall, they bump their mouth, and they tear this frenum. My daughter actually just did that a few weeks ago. She was gushing blood, but basically what you do in these situations, typically they're fine. Wipe the area, apply some pressure with gauze, apply some ice packs, and then typically that should stop the bleeding and the child should be okay. And then at that point, you can make a phone call to your pediatrician or to your pediatric dentist and find out if you need to come in or further guidance. But this is a very, very common injury. Typically, no stitches are needed, and it's just a lot of ice packs and hugs and tissues for that one. And then this is sort of a slide that shows you what to do if a child gets hit in the mouth and a tooth either gets knocked out or broken. And I realize that the print on this slide is pretty small. So I'm sure many people have heard that if a baby tooth gets knocked out, to put it in a cup of milk. Most school nurses know this rule, most people know this rule. What they don't know though is that putting it in a cup of milk only applies to a permanent tooth, and it only applies if the whole entire tooth, including the root, gets knocked out. So if someone just chips a little corner of a tooth, there's not really need to put it in milk. It's more like I said, if the whole tooth with the root comes out. If a baby tooth gets knocked out, even if it comes out with the whole entire root, you definitely want to save it and bring it in for your pediatrician or dentist to take a look. But there's no reason to keep it in milk, because we do not put baby teeth back into their sockets, because if you put the baby teeth back in their sockets, it can disrupt the growth of the permanent teeth. So the only teeth that get placed back in are adult teeth. If a tooth is chipped or broken, again, no need to put the chip in some milk. You can definitely bring it in if you are able to find it, but basically if a tooth is chipped or broken, the dentist can either file down the rough edge or put some bonding material if indicated. And then lastly, sports guards. Once your kids are old enough to play sports, please make sure that they do wear a mouth guard to avoid these injuries during sports. Any questions?
So pacifiers are okay, so they're 2.
Yeah.
Well, she's 11 months. Baby's
Okay.
11 months, and I made the mistake with my older daughter of not taking it away when she was 2. It was gone by the time just before she was 3, but it made it really hard because she was old enough to ask for it, explain.
Right.
So I cut the tip. This is broken. She threw it at me.
Yeah, three-year-olds are very smart.
So I'm not making that mistake.
So I would say the earlier you can try to make the transition, the better. So
I was going to try this summer.
Yeah.
It
So
should be 1, but then I was concerned that she's teething, it would help her.
So the pacifier only typically reaches the front teeth, and especially when the molars start to come in, you'll see the children taking the pacifier and just putting it to the side and sort of just chewing on it. But then they're still able to put it back to the front to suck on it. So it's better for the teething phase to switch to a teething ring or something else that's meant just to be chewed on, so that they're not sucking on it as well. Yeah.
Can they brush too long? Is it overbrushing?
Most kids tend to underbrush.
Right. I have a 12-year-old and a 5-year-old who underbrush, but I have a 9-year-old that I have to to stop her sometimes and say,
Wow.
you can brush your teeth away.
Wow, that's very impressive.
So I just wanted to.
It actually is possible to overbrush. The recommended amount of time for brushing is 2 minutes, and the pressure of the brushing should not be too hard as well, because people who do a very hard back and forth motion can actually wear away their enamel as well as some of the gum tissue. And so a soft circular motion is preferred, and again, 2 minutes total. What I find some children do as well is they'll brush for a long time, but they'll brush one spot. So they can say, yeah, mommy, daddy, I brushed for 10 minutes, but they're only brushing the edges of the front teeth. So you really want to make sure that they're getting the toothbrush all around, that they're getting to the cheek surfaces, to the tongue surface, to the backs, to the fronts.
And the electronic toothbrush is okay?
Electric ones are really great, but again, the child has to be moving it around their mouth, because you can sit there with a motorized brush and think that it's doing a good job, but there's no avoiding actually getting the toothbrush around the mouth into all the appropriate surfaces.
Do you recommend the soft for medium head or?
Soft bristles are preferred, as I mentioned, to try to avoid wearing away the enamel or the gum tissue. So for adults as well, soft brushes are recommended. Yeah. Yeah.